Good afternoon, my people. How on a day? Up on a day, alright? Up on a day, fine. Yeah, we are here again. We are here on another session of Spirit Out with Erad, and we have here because
Monica Grace.
Yeah, so it's a very great privilege here for us to have a student nurse, a registered nurse, and a certified community nurse in progress. So we just be asking some questions about nursing and nursing career generally, and how life has been fair on the part of nurse. Because in recent times we hear a lot about nurses and doctor having some kind of agreement or rift about who is the boss between the two. Yeah, you understand what I'm trying to say?
I get it.
Yeah, so what is your perspective about this? Do you feel the nurse is superior to the doctor, or do you feel the doctor is superior to the nurse? Just let us know.
Okay, when it comes to healthcare setting, there is no superior, there is no inferior or subordinate or anything. The doctors, the nurses, the physiotherapists, all of them, they all work together.
I mean, everybody's on the same page.
They all work together to reach, should I call it an expected end, and that is for the health of their patient. They don't have to fight for who is superior to the other or anything. The nurse has his or her work description. The doctors too, they have their work description. The physiotherapists, they have their work description. The medical lab scientists, all of them, they have their work description.
Okay, so quickly now, what is the job description of a nurse?
Nursing, we say nursing is caring unlimited. So majorly we care, and just for that we care majorly.
Yeah. What do you care for? You care for animals?
We care for patients. Yes.
Okay. You can continue.
Still on the work description of nurses, actually, when doctors come, they just come to check on their patients. They give orders, like they write down that okay, this should be done for the patient. Like, okay, for example, a patient that has maybe kidney issues, and then the patient has to be on diuretics. The doctor is not going to be there to be giving the drugs to the patient every 2 hourly or whatever, but so far the doctor writes the notes that okay, diuretics should be given to this patient 2 hourly. Then the nurse will write that.
Then it's almost as if the doctor is the one giving it.
No, that is not it.
So how is it? Explain to me. I'm not really getting it now.
Okay, it is the job of the nurse. So the nurse knows that, okay, she's supposed to do that. She's supposed to check the case note and to do whatever is supposed to be done. Also, if the patient is being discharged at that moment, the patient himself will be the one to care for him or herself. He'll be the one to know that I should take diuretics so highly. So it's just like you are caring for that person in place of himself. That's just
so what you are trying to tell us now is that the work of a nurse is something not really, really important, that anybody can do it. But the work of a doctor, I'm not sure anybody can do it, because you as a person, if you are sick, you can't just allow anybody to operate on you or to just give you anything, just any prescription. But anybody can care for you, anybody can nurse you. That's what you are trying to tell us. So, and I feel with this, we should give some accolades to the doctors.
No, I'm not saying anybody can care for anybody or anybody can be a nurse. That's not it.
Okay.
A nurse does a professional care.
Professional.
Yes, there is a way you will care for someone, and you don't get to complicate the issue. Okay. Just anybody doing that will complicate things. Okay, say for example, a patient has just been operated upon, and then the person is in the post-operative care room or anything. You can say just anybody will come and take care of the wound and do wound dressing or anything, but a nurse will do that in a more professional way, in such a way that he or she will not introduce infection to the wound. When you do an operation, you're making an incision.
Sorry, I think even the doctors can do that, right?
Well, there are procedures that both doctors and nurses can do.
Definitely, that kind of thing, doctor can do it, but the work of a doctor, a nurse cannot do it, but a doctor can multitask as a doctor and a nurse.
You know what? A nurse can actually do some of the things that a doctor can do.
Okay.
But we are not licensed to do it. That is it.
You are not licensed.
Yes, we are not licensed to do it.
For the fact that you are not licensed,
That is why a doctor should remain in his position and allow the nurse to also do her own job, since I am licensed to do it.
But with the way you are saying these things, I feel you are saying it's like the doctor should remain in his position.
Yes, do his own job.
Not in a superior place to the nurse or something.
What I am saying is the doctor has what he is supposed to do and the nurse has what she is supposed to do. They should not overstep their boundaries.
They should not overstep there.
Yeah, a doctor can actually do wound dressing too. Okay. There are situations where the doctor will have to do the wound dressing, but it is like a job description of the nurse to do. Okay. Yes, but in a situation where the nurse has done the wound dressing for the day and then the doctor came around to check the site that, okay, how is this one doing and all of that, and then he removes the dressing, he will have to do the dressing himself. That is it.
So, okay, fine. I agree with you on that. So, first of all, let's go to the part which is the basic salary for a nurse and the basic salary for a doctor. Actually, I've seen some paychecks, I've seen some payrolls, and I've seen nurses one, I've seen doctors one, and in a way, the doctors one is kind of higher and better than that of nurses. So, you as a nurse, what can you say about that? Do you think the federal government or the healthcare system, they are not fair enough on the part of the nurses or what? What do you think about this?
Well, the doctors getting more paid than the nurses. That's not my issue.
Okay.
But the thing is, the nurses and everybody should be paid, according to the way they work. I mean, I should not be getting underpaid. How do I put it? Like, I'm doing so much work and you are paying me very little.
Do you feel the healthcare system is paying the doctor more than? Do you feel they should pay the doctor more than the nurses? Like, them using the same number of hours at work, do you feel they should receive the same amount, like salaries and all?
Well, I don't know. I can't say much about that, but it's not bad if we collect the same amount, since we are working with the same hour, like you work 2 hours, I work 2 hours, we should get paid since we are working in the same facility, in the same unit. Then,
so it is almost like a case of gender equality. That is almost what you are trying to push here. It's just a case of husband and their wife in a marriage. Okay, let's put the wife as the nurse and the husband as the doctor. In a way, both of them, they are almost on the same page and they have their own responsibilities to do.
Mm-hmm.
But then the society still give praises more to the husband, and there are some accolades that the wife receives too, but in a way they rank the husband as more superior. So I think that is what is happening in the case of a doctor and a nurse. And what will happen if the doctor and the nurse, if they get married and the wife is a person clamoring for gender equality, and at work they're having their differences of who is higher between a nurse and a doctor, and at home you're having a case of gender equality? What do you think? Do you think their marriage can last?
Kind of. It might actually bring a lot of disagreements. I mean, they will have a lot of issues to settle, because the work issues we always affect the one at home, and the one at home will always affect the one at work. Feeling like, hey, you're superior to me, they're always having disagreement, and then when they get home to, the wife will not want to be submissive as per the gender equality thing. So it's really, really going to bring problems to their marriage. So I don't know. They will have to settle themselves, because me as a person, I'm not ready to get married to a doctor actually, so I'm not ready to think about all of those.
Thank you very much. Really appreciate it. Really appreciate your effort on this program, and we're almost rounding up. Can you just give a word to our listeners and about their age, something they should keep doing or what they should stop doing? Just a word or a sentence.
Okay, so one thing I will say to everybody listening to me is that take care of your health. I mean, something happened recently. Someone died, and the person died of breast cancer, and I was totally surprised. I mean, breast cancer is no longer something new, and there are a lot of ways to prevent the end effect, I mean the end stage of it, which is death, there are a lot of ways to prevent it. So it's actually not nice on you, and it's not nice on your family members if you decide to keep it to yourself. If you have things that are bothering you, in your health, you know that okay, there are changes, you know that you're feeling one kind, it is just very good that you go to the hospital. But a lot of people will feel like it's a go, and some people will feel like this is spiritual attack, and then they have to pray. I'm not saying you should not pray, you should, but there's a place of medical intervention. So take care of your health, because it will really tell on you, tell on your family, tell on your loved ones. So just take care of your health.
Wow, that is cool. Well, anyways, you look beautiful. Thank you very much. And finally, my name is Erad, and we have here
Amanisa Grace.
Thank you so much.
Thank you, so thank you for listening.
Spit it out with Erad. So
thank you for
our followers, don't worry, you will hear from us next week. I guess we are done with this week episode. And if you have any questions regarding this program for today, just send in your questions. Our nurse is still on seat. So thank you so much. He's saying thank you.
Bye.